Welcome to this explainer. Today, we're tackling a super common yet totally misunderstood source of back pain. Going through the data from top orthopedic experts, I realized something right away. Understanding your own spine really doesn't have to be intimidating. In fact, if you've ever dealt with back pain, or even just know someone who has, you know how incredibly frustrating and isolating it can feel. But today, we're going to make the anatomy of the back accessible, completely clear, and honestly kind of delicious. We're going to piece this all together and hopefully give you some real clarity.
So, let me start off with a question you probably weren't expecting today. What exactly does your spine have in common with a pastry? Specifically, a jelly donut. I know, it sounds completely crazy at first, right? But believe it or not, this simple, everyday bakery item is actually the absolute perfect analogy for understanding the complex biomechanics of your back. By the time we finish this explainer, you will literally never look at a jelly donut or your own spine the exact same way again.
All right, let's get into it. Section 1. The jelly donut spine.
33. That's the magic number. The human spinal column reaches all the way from the base of your skull right down to your pelvis, and it's made up of exactly 33 bones, which we call vertebrae. Now, these bones stack intricately on top of each other to give you stability, protect your spinal cord, and carry all of your upper body weight throughout the day. But think about it, if it were just solid bone grinding on solid bone every single time you moved, life would be absolutely agonizing. We wouldn't even be able to twist or bend. So sitting right between these 33 bones are our ultimate shock absorbers, our spinal discs.
And this is exactly where our bakery analogy saves the day. Every single one of those shock-absorbing spinal discs has two main anatomical parts. The intimidating medical term for the outside is the annulus fibrosus. This is made of concentric sheets of tough fibrous collagen. Just think of this as the thick, protective dough of our donut. Inside that tough exterior is the nucleus pulposus. That's a soft, remarkably gel-like center that's filled with water. Yep, that is the jelly. So a healthy, fully functioning spinal disc is quite literally a perfectly plump jelly donut, keeping your neck and back fluid while minimizing the intense friction between those 33 vertebrae.
Moving right along to Section 2, Why the Jelly Leaks.
3 million. That is how many people in the US alone experience a herniated disc every single year. When you really think about that sheer volume, it's staggering. It's enough to fill hundreds of sports stadiums. So, if you are dealing with this deep, nagging pain right now, please know you are far, far from being alone. It is a massive, widespread human experience, and figuring out exactly why it happens is the crucial first step to getting it fixed.
So why does it happen to so many of us? Well, the main culprits are wear, tear, and dehydration. Our spinal discs actually begin to degenerate at a surprisingly young age. As we go through life, these discs naturally lose their water content and their youthful elasticity. Think about what happens to a jelly donut when you accidentally leave it sitting out on the kitchen counter for a few days. It gets kind of stale, right? The dough becomes brittle, thin, and way less flexible. Your spinal discs do the exact same thing over time, making that protective outer dough layer much more prone to tearing under pressure.
Now, aging is naturally the biggest factor accelerating this wear and tear, making up about 40% of the risk. But look at the other major factors involved here. Carrying excess weight literally compacts the spine, constantly squishing those delicate discs under heavy gravitational pressure. And smoking? Actually, this part is pretty fascinating in a terrible way. Smoking releases specific toxins that actively impede the circulation of essential nutrients to your spine. You are quite literally cutting off the food and water supply to your discs, making that dough dry out and crack way faster than it ever should.
Which brings us to Section 3, bulging versus herniated discs.
Okay, let's clear up one of the most common medical mix-ups out there. With a bulging disc, the donut is just squished. It's protruding outwards, maybe from poor posture or a lifetime of heavy lifting, but the outer dough is completely intact. The structural integrity holds, and no jelly has escaped. A herniated disc, on the other hand, is a much more severe structural failure. The dough actually tears open, and that inner water-filled jelly actively leaks out of the disc and spills directly into the spinal canal.
To really reinforce the physical reality of this, the medical experts at Florida Surgery Consultants put it perfectly. They say, a herniated disc involves a rupture in the tough exterior, causing the inner gel-like substance to push out. So it's not just a passing pressure issue, it is a literal physical breach of the disc wall. And because that irritating jelly is now sitting out in the spinal canal where it absolutely does not belong, it sets off a very specific and often agonizing set of alarm bells in your body.
Next up, Section 4, spotting the symptoms.
Patients almost universally describe this specific pain as an electric shock nerve pinch. And anatomically, that makes perfect sense. Your spinal canal is packed tight with incredibly sensitive nerve roots. When that acidic jelly leaks out of the disc, it physically presses against and chemically inflames those nearby spinal nerves. This doesn't just feel like your standard dull post-workout muscle ache. No, it causes a sharp, burning, electric-like pain that suddenly shoots through your body without warning.
And where you feel that intense shock depends entirely on which specific donut leaked. If a disc herniates in your cervical spine, that's the area up in your neck, you'll likely feel a deep, throbbing pain in your neck and shoulders. But it usually doesn't stop there. You might also feel a weird numbness or tingling sensation shooting down your arms and right into your hands. Now, if it happens in your lumbar spine, your lower back, which is by far the most common spot, you get what is widely known as sciatica. This is that intense, radiant pain traveling deep down your buttocks, straight into your legs, and sometimes even all the way down to your feet, often accompanied by a sudden, alarming muscle weakness.
Now, we absolutely need to talk about some red flag symptoms here. Look, most herniated discs are incredibly painful, sure, but they are ultimately manageable. However, if you ever experience progressively worsening muscle weakness that literally causes you to stumble when you walk, or if you have a sudden unexplained loss of bowel or bladder control, you need to get help immediately. Same goes for something doctors call saddle anesthesia, which is a profound numbness in the exact areas of your body that would touch a horse's saddle. These symptoms indicate a severe condition like cauda equina syndrome, where the entire lower bundle of nerves at the base of your spine is being critically compressed. It's a true medical emergency.
And finally, we arrive at Section 5, fixing the leak.
Go ahead and take a deep breath here. As the experts explicitly state, no, a herniated disc does not mean you need surgery. What a massive relief. It's arguably the biggest myth out there. According to top orthopedic hospitals, the vast majority of herniated discs actually heal and resorb entirely on their own within 4 to 6 weeks. The human body has this absolutely incredible capacity to recognize that leaked jelly, meticulously clean it up, and naturally heal the tear without a surgeon's scalpel ever touching your skin.
So how do doctors actually treat it while it's busy healing? Let's walk through the logical escalation of medical care together. Step 1 is always conservative. A few days of careful rest, over-the-counter anti-inflammatory meds to calm down those angry nerves, and most importantly, targeted physical therapy to slowly build up the core muscles supporting your spine. If that doesn't quite do the trick over time, we cautiously move to Step 2, interventional injections. These are things like epidural steroid shots delivered right into the spine to forcefully knock out the localized inflammation. Only when all of those conservative measures fail do doctors even begin to look at Step 3, which is surgery.
But if you do eventually need surgery, the options available today are incredibly advanced. They act as highly precise surgical last resorts. For instance, a microdiscectomy is a minimally invasive procedure where the surgeon uses a specialized microscope to go in and simply remove that one tiny piece of leaked jelly that's actively pressing on the nerve. A laminectomy safely removes a tiny bit of bone to give a swollen nerve more physical room to breathe. And in some more complex cases, they can even perform a total artificial disc replacement. Because so many of these are minimally invasive now, recovery times are vastly improved compared to those grueling open-back surgeries from the past. Of course, the absolute best surgery in the world is the one you never have to get. So how do we actively keep our donuts plump? Well, you really do have the power to prevent this. Try to maintain a healthy weight to take the mechanical, gravitational pressure off those lower discs. Practice safe lifting mechanics. Always bend those knees. Never just fold at your waist. Take frequent, dedicated stretching breaks if you sit hunched at a desk all day to decompress your spine. And absolutely stop smoking to ensure your discs get the rich, hydrating blood flow and nutrients they desperately need to stay flexible.
Check out this number. An estimated 60% of adults over the age of 45 experience lower back pain. If your back is hurting right now, you are participating in a nearly universal human experience. Our spines endure a tremendous, almost unfathomable amount of mechanical stress just keeping us upright against gravity every single day.
So let me leave you with this thought. If your spine works tirelessly to support you every single day, isn't it time you finally gave your jelly donuts the care they deserve? By understanding the beautiful, complex mechanics of your back, actively maintaining good posture, staying physically active, and simply knowing when to seek professional help, you can keep your spine healthy, resilient, and pain-free. Thank you so much for joining me on this explainer today. Keep those donuts plump, and I'll catch you next time.